To understand ischemic heart disease, we first need a basic look at how our heart works. Think of your heart as a remarkable pump working tirelessly every second, every minute of your life. It's nestled compactly in your chest, but it has a huge job pumping oxygen-rich, nutrient-filled blood to every corner of your body from your brain to your toes. At the same time, it also collects used oxygen-poor blood to return to the lungs, where the blood gets cleaned and refilled with fresh oxygen. So how does the heart nourish itself? The heart has its own dedicated blood supply system called the coronary arteries. Imagine the coronary arteries as small but incredibly important highways that wrap around your heart, directly supplying oxygen-rich blood to your heart muscle. It's thanks to these highways that your heart has enough energy to perform its continuous pumping job. People with diabetes often have a higher risk of other cardiovascular diseases, like high blood pressure and abnormal cholesterol levels. If you have diabetes, strict control of your blood sugar through diet, exercise, and medication, as prescribed by your doctor, is crucial to protect your heart and blood vessels. Obesity and overweight. Being overweight or obese, especially with fat accumulated around the abdomen, is strongly linked to a higher risk of ischemic heart disease. Obesity increases the risk of other risk factors, like high blood pressure, diabetes, and high cholesterol. Maintaining a healthy weight through a balanced diet and regular physical activity is an effective way to reduce the risk of heart disease. For older adults, even losing a small amount of weight can bring significant benefits for heart health. Lack of physical activity. Sedentary lifestyle. A sedentary lifestyle contributes to the risk of obesity, high blood pressure, high cholesterol, and diabetes. Conversely, regular physical activity helps strengthen the heart muscle, improves blood circulation, lowers blood pressure, improves cholesterol levels, and helps control blood sugar. You don't need to be an Olympic athlete. Even a brisk 30-minute walk most days of the week can bring tremendous benefits. Stress and depression. Chronic stress can contribute to heart disease risk through various mechanisms, including increased blood pressure changes and cholesterol levels, and encouraging unhealthy habits like overeating, smoking, or drinking alcohol. Depression is also strongly linked to cardiovascular disease, and conversely, cardiovascular disease can also lead to depression. Finding effective ways to manage stress, e.g., meditation, yoga, spending time on hobbies, social connection, and seeking professional support. If you are dealing with depression, it's very important to protect your heart. Unhealthy diet. A diet high in saturated fats, trans fats, cholesterol, salt, and sugar can increase the risk of heart disease. Conversely, a diet rich in fruits, vegetables, whole grains, fatty fish, and nuts will help protect your heart. You might find that you have one or more of the risk factors listed above. Please don't worry too much. The important thing is that you are aware of them. Most of these risk factors can be managed or changed through a healthy lifestyle and medical guidance. Consider this a reminder to start making positive changes, even small ones. Warning signs. Listen to your body. Our heart is a loyal friend, and it often sends us warning signals when something is wrong. Recognizing these signs, especially in older adults, is extremely important to seek timely medical help. Never ignore symptoms that seem minor, as they could be your heart's cry for help. Chest pain, angina. The classic sign. Angina is the most common symptom of ischemic heart disease. It occurs when the heart muscle isn't getting enough oxygen. Imagine it's like a Charlie horse muscle cramp in your leg when you overexercise, but this time it's in your heart muscle. The sensation is often described as a heavy, squeezing tightness, pressure, or aching sensation in the middle of your chest. It can feel like an elephant sitting on your chest, or a tight band squeezing around it. While usually in the center of the chest, the pain can spread to the left shoulder, left arm, especially the inner arm, neck, jaw, back, or even the upper abdomen. The pain usually lasts a few minutes, typically 1 to 5 minutes, but not more than 20 minutes. It's often triggered by exertion, e.g., walking uphill, climbing stairs, lifting heavy objects, emotional stress, or exposure to cold weather. It usually lessens when you rest or take vasodilator medications like nitroglycerin. There are two main types. Stable angina symptoms appear predictably, always occurring with a certain level of exertion and lessening with rest or medication. This indicates significant narrowing in the coronary arteries. Unstable angina. This is a more serious condition and requires immediate medical attention. The pain can occur at rest, last longer, or become more severe and frequent than before. This could be a sign of an impending or ongoing heart attack. Shortness of breath, common in older adults. One important but often overlooked symptom, especially in older adults, is shortness of breath. When the heart cannot pump blood effectively due to lack of blood fluid can accumulate in the lungs, causing a feeling of breathlessness. Shortness of breath can occur with exertion or even at rest, particularly when lying down. In older adults, shortness of breath can be the only symptom of ischemic heart disease, without the typical chest pain. This can be mistaken for lung problems or simply dismissed as a natural part of getting older. Never underestimate unexplained shortness of breath. Extreme fatigue, vague but important sign. Feeling tired is natural as we age or when we overwork. However, extreme, persistent, and unexplained fatigue, especially when it affects your daily activities, can be a sign of ischemic heart disease. When the heart has to work too hard to pump blood or doesn't receive enough oxygen, the entire body feels exhausted. Atypical symptoms, especially in women and older adults. This is an extremely important point to remember, especially for women and older adults. The symptoms of ischemic heart disease or a heart attack can be very different from the typical image we often see in movies. It could be pain or discomfort in other areas, such as the jaw, neck, throat, a feeling of tightness or numbness, back or shoulder pain, especially pain between the shoulder blades or in the right shoulder, arm pain or discomfort. Not just the left arm, but both arms or the right arm can also be affected. Upper abdominal pain, which can be mistaken for indigestion, heartburn or stomach pain. Additionally, there might be nausea or vomiting, cold sweats, dizziness or lightheadedness, or difficulty sleeping and unexplained anxiety. Why are these symptoms different in older adults and women? There are many reasons. First, older adults may have many other coexisting medical conditions that mask cardiac symptoms. Second, the sensation of pain may not be as intense or clearly localized as in younger people. Third, the nervous system of older adults may react differently to pain. Most importantly, women often have less typical symptoms than men, sometimes just fatigue, shortness of breath, or nausea, leading to delayed diagnosis. Silent heart attack. The most frightening thing is that some people can have a heart attack without even knowing it, or only have very mild, unclear symptoms that they ignore. This is called a silent heart attack. This is more common in older adults and those with diabetes. Although there are no obvious symptoms, a silent heart attack still causes damage to the heart muscle and increases the risk of serious heart problems in the future. That's why regular health checkups and managing risk factors are extremely important. When to call 911 for emergency help. This is the most important part of symptom recognition. If you or a loved one experiences any of the following symptoms, especially if they appear suddenly or get worse, do not hesitate. Call 911 immediately. Symptoms that require calling 911 include severe chest pain or chest discomfort lasting more than a few minutes, or not relieved by rest, nitroglycerin. Pain spreading to other areas such as the shoulder, arm, back, neck, jaw, or upper abdomen. Severe shortness of breath, especially if accompanied by chest pain. Sudden cold sweats, nausea, dizziness, or lightheadedness. Unexplained extreme fatigue, especially if accompanied by other symptoms. Do not try to drive yourself to the hospital. Calling 911 will help you receive immediate emergency medical care on the spot and during transport, which can save your life. Time is heart muscle. Every minute that passes without treatment, more heart muscle will be damaged. Diagnosis: the journey to finding answers. When you have symptoms suggesting ischemic heart disease, the next step is to see a doctor for an accurate diagnosis. The diagnosis process includes gathering information, a physical examination, and performing a series of specialized tests. The goal is to determine if there is a coronary artery blockage, its severity, and if the heart muscle has been damaged. Your doctor will begin by carefully listening to your symptoms, asking about your personal and family medical history, as well as any risk factors you may have. Please be prepared to share all relevant information, including the frequency, nature, location, duration, and factors that trigger or relieve your symptoms. Your doctor will also check your blood pressure, heart rate, and listen to your heart and lungs. This is the first but extremely important step. There are three main coronary arteries: the right coronary artery, the left anterior, descending artery, and the circumflex artery. Each of their smaller branches feeds a different part of the heart muscle. Now imagine what would happen if one of these highways became clogged or narrowed. That's the core of ischemic heart disease. The term ischemia simply means lack of blood flow to a part of the body. In this case, it means the heart muscle isn't receiving enough oxygen-rich blood and nutrients it needs to function properly. The most common cause of ischemic heart disease is a process called atherosclerosis. Imagine that over time within the walls of our arteries, fatty substances, cholesterol, calcium, and other materials in the blood can build up. They form a sticky plaque that clings to the artery walls. Initially, this plaque might be small and cause no problems. There are many different types of tests to diagnose ischemic heart disease. Your doctor will decide which test is most appropriate for your condition: electrocardiogram, ECG, or EKG. This is a quick, non-invasive, and painless test. An ECG records the electrical activity of your heart. It can detect signs of heart muscle damage due to ischemia or a heart attack, as well as heart rhythm problems. An ECG is usually done both at rest and sometimes during exertion, called a stress ECG. Blood tests. Important blood tests include troponin, a protein released into the blood when heart muscle is damaged, cardiac enzymes. Other enzymes can also increase with heart muscle damage. Cholesterol and lipids, measuring LDL, HDL, and triglycerides. Blood sugar glucose and HbA1c to check for diabetes, CRP, C-reactive protein, a marker of inflammation. Stress test. A stress test helps your doctor see how your heart works when it has to work harder. You'll walk on a treadmill or ride a stationary bike while your ECG and blood pressure are monitored. If you cannot exercise, your doctor may use medication to make your heart beat faster, similar to when you exert yourself, called a pharmacological stress test. The goal is to see if any signs of ischemia appear when the heart is stressed. There are various types of stress tests, including routine stress tests, nuclear stress tests, myocardial perfusion scan, and stress echocardiograms. Echocardiogram. An echocardiogram uses sound waves to create moving images of your heart. It allows the doctor to assess the size and shape of your heart, the pumping function of its chambers, the activity of the heart valves, and whether any areas of the heart muscle have been damaged due to lack of blood flow. Coronary CT angiography, CTA. This technique uses special X-rays and contrast dye to create detailed images of the coronary arteries. It can help determine if there is narrowing or blockage in the arteries without requiring an invasive procedure. Coronary angiography, cardiac catheterization. This is considered the gold standard for accurately diagnosing ischemic heart disease. In this procedure, a small flexible tube catheter is inserted into an artery in your groin or wrist and guided up to your heart. A contrast dye is then injected into the coronary arteries and X-ray images are taken. The contrast dye allows the doctor to clearly see the coronary arteries and pinpoint the exact location and severity of any narrowing or blockage. This procedure is usually performed when other non-invasive tests are not clear enough, or when the doctor suspects a serious blockage that requires intervention. The diagnosis process may involve one or more of these tests depending on your specific condition and your doctor's assessment. It's important to openly discuss any concerns with your doctor and ask questions about the recommended tests. Remember, early and accurate diagnosis is key to effective disease management and improving your quality of life. Treatment towards a healthier heart. Once ischemic heart disease has been diagnosed, the next step is to develop a comprehensive treatment plan. The goal of treatment is not only to reduce symptoms, but also to prevent the disease from progressing, reduce the risk of cardiac events like heart attack or stroke, and improve your overall quality of life. The treatment plan usually involves three main pillars: lifestyle changes, medication, and in some cases, interventional procedures. Lifestyle changes, the foundation of all treatment. The importance of lifestyle changes cannot be overemphasized. This is not just a part of treatment, but also the foundation for you to live healthily with ischemic heart disease, and even to prevent it. Heart-healthy eating diet is a crucial factor. Focus on reducing salt limit processed foods, reducing saturated and trans fats, avoid fatty red meats, poultry, skin, palm oil, fried foods. increasing monounsaturated and polyunsaturated fats in olive oil, avocados, nuts, fatty fish, eating plenty of fruits and vegetables, choosing whole grains, opting for lean protein fish, skinless poultry, tofu, limiting sugar and sugary drinks, and controlling portion sizes. Regular physical activity exercise is a wondrous medicine for your heart. It helps strengthen your heart muscle, lower blood pressure, improve cholesterol levels, aid in weight loss control, blood sugar, and reduce stress. Aim for at least 150 minutes of moderate intensity physical activity per week. Activities like brisk walking, cycling, swimming, dancing, gardening, chair, yoga, and Tai Chi are all very beneficial. Always consult your doctor before starting any new exercise program, especially if you have heart disease. Start slowly and gradually increase intensity and duration. Listen to your body. If you feel chest pain, shortness of breath, or dizziness, stop immediately and seek help. Quit smoking. This is the best thing you can do for your heart. The risk of heart attack significantly decreases within just 1 year after quitting. Seek support from family, friends, your doctor, or smoking cessation support groups. Weight management. Losing even a small amount of weight can significantly improve blood pressure, cholesterol, and blood sugar. Aim for sustainable, slow weight loss through diet and exercise. Stress management and mental health. Chronic stress and anxiety can negatively affect your heart. Find healthy ways to cope, such as meditation, deep breathing, yoga, spending time on hobbies, social connection, and getting enough sleep. If you feel anxious or depressed, don't hesitate to talk to your doctor or a mental health professional. Medications. Essential support. Medications play an important role in managing ischemic heart disease, helping to reduce symptoms, prevent complications, and extend life. Your doctor will prescribe medication based on your specific condition. Always adhere to the correct dosage and timing of medication as prescribed. Do not stop medication or change dosages on your own. Antiplatelet medications. For example, low-dose aspirin, clopidogrel. They help make your blood less sticky, preventing blood clots from forming in narrowed coronary arteries, thereby reducing the risk of heart attack and stroke. Beta blockers. For example, metoprolol, bisoprolol. They slow your heart rate and reduce the force of your heart's contractions, thereby decreasing the heart muscle's oxygen demand and reducing the burden on your heart. They help reduce angina and lower the risk of heart attack. Statins. For example, atorvastatin, rosuvastatin. These are powerful medications that help lower bad cholesterol LDL levels in your blood. They also help stabilize atherosclerotic plaques. ACE inhibitors, or ARBs. Angiotensin receptor blockers. For example, lisinopril, AC inhibitor, valsartan, ARB. They help relax blood vessels, lower blood pressure, and reduce the workload on your heart. Nitrates. For example, nitroglycerin. They quickly relax blood vessels, including coronary arteries, helping to increase blood flow to the heart and relieve chest pain. Calcium channel blockers. For example, amlodipine, diltiazem. They help relax blood vessels, lower blood pressure, and can slow your heart rate depending on the type. Taking medication correctly is extremely important. Make sure you understand the medication names, dosages, timing, and potential side effects. Don't hesitate to ask your pharmacist or doctor if you have any questions. Bring a list of all medications you are taking when you visit your doctor. Interventional procedures. When you need more help. In some cases, when lifestyle changes and medication are not enough to control the disease, or when there is a severe blockage, your doctor may recommend interventional procedures to restore blood flow to the heart. Percutaneous coronary intervention, PCI, angioplasty with stenting. This is a less invasive procedure. A small balloon is guided to the narrowed artery and inflated to press the plaque against the artery wall, widening the artery's passage. Often a small metal mesh tube called a stent will be placed to keep the artery open. Coronary artery bypass, graft CABG surgery. This is a larger open heart surgery. Your doctor will take a healthy blood vessel from another part of your body and use it to create a bypass around the severely blocked coronary artery. The choice of treatment method, especially between stenting and bypass surgery, will be thoroughly discussed with you by your doctor and medical team, based on the severity of your condition, the number and location of affected arteries, your overall health, and any coexisting medical conditions. Don't hesitate to ask questions and express all your concerns. Cardiac rehabilitation, your important companion. Cardiac rehabilitation is a medically supervised program customized for each individual designed to help you recover and improve your heart health after a heart attack, heart surgery, or a diagnosis of ischemic heart disease. The program includes supervised physical exercise education on managing heart disease and counseling to help you cope with stress. But over many years, especially as we get older, and if we have other risk factors, this plaque can grow larger, harden, and make the artery walls thicker and stiffer. As a result, the artery's inner passage narrows much like a water pipe getting clogged with residue. When a coronary artery becomes severely narrowed, the amount of oxygen-rich blood reaching the heart muscle significantly decreases. This becomes especially noticeable when the heart needs to work harder. For example, when you exercise, climb stairs, or even when you're emotionally stressed. At these times, the heart muscle's demand for oxygen increases, but the supply is limited. This imbalance is what causes the symptoms of ischemic heart disease, most typically chest pain, also known as angina. More dangerously, sometimes the surface of this atherosclerotic plaque can crack or rupture. Most patients diagnosed with ischemic heart disease are encouraged to participate in this program. Living with ischemic heart disease. Quality of life in your golden years. Being diagnosed with ischemic heart disease can be a shock, but it's not the end of your active and meaningful life. In fact, with proper management, many people can continue to live a full and active life. Adhere to your treatment plan. No exceptions. This is the key to maintaining heart health. Take your medication correctly and completely attend scheduled doctor's appointments, undergo follow-up tests, and commit to incorporating lifestyle changes into your daily routine. Self-monitoring and recognizing changes. You know your body best. Learn to listen to it by keeping a symptom diary, monitoring your blood pressure and heart rate at home if your doctor recommends it, and always remember the emergency signs to call 911 immediately. Mental and emotional well-being. Don't overlook it. Living with a chronic illness can bring many emotions. Learn to accept and adapt. Share your feelings with loved ones. Seek support from support groups or psychological counseling practice. Relaxation techniques. Maintain hobbies and keep a positive attitude. The role of caregivers, precious companions. For many older adults, support from family and caregivers is incredibly important. Communicate openly, support medication adherence and healthy lifestyle choices, accompany them to appointments, provide emotional support, and importantly, caregivers also need to take care of themselves to avoid burnout. Oral health. Surprisingly important. Poor oral hygiene can be linked to heart disease. Bacteria from gum disease can enter the bloodstream and cause inflammation in blood vessels. Brush your teeth twice a day, floss daily, and visit your dentist regularly. Flu and pneumonia vaccinations. Absolutely essential protection. Older adults with ischemic heart disease are at higher risk of serious complications if they contract respiratory infections. Make sure you get your annual flu shot and pneumonia vaccine as recommended by your doctor. Traveling with heart disease, plan carefully. Heart disease doesn't mean you have to give up the joy of travel. However, careful planning is necessary. Consult your doctor before your trip, carry enough medication and medical records, know emergency locations, and stay active during long trips. Sexual activity and heart disease. Common concerns. Many people with ischemic heart disease worry about sexual activity. Most patients can continue sexual activity safely. The most important thing is to discuss it with your doctor to assess safety and be aware of drug interactions, especially between erectile dysfunction medications and nitrates. Prevention. It's never too late. Whether you have been diagnosed with ischemic heart disease or not, prevention is always essential and brings tremendous benefits. For those who already have the disease, prevention helps stop the disease from progressing and reduces the risk of events. For those who don't have the disease, prevention helps you maintain a healthy heart for the rest of your life. Focus on controlling modifiable risk factors. Do not smoke, control blood pressure, cholesterol, and blood sugar. Maintain a healthy weight. Be physically active regularly, eat a healthy diet, and manage stress. Even if you feel completely healthy, regular health checkups are extremely important, especially as you get older. Your doctor can screen for risk factors before they cause symptoms and offer appropriate advice. Understanding heart health is power. Continue to seek reliable information from reputable medical sources and share this knowledge with family and friends to build a healthier community together. Common misconceptions about heart disease. Among older adults, there's a lot of information, both true and false, about heart disease. Especially in older adults, some misunderstandings can lead to delayed treatment or improper health care. Let's clarify a few common myths. Myth 1. I'm older now. Heart disease is just something I have to accept. The truth. While age is a risk factor, heart disease is not an inevitable part of aging. Controlling risk factors and maintaining a healthy lifestyle can significantly reduce the risk of heart disease at any age, even as you get older. Myth 2. If I have a heart attack, I'll definitely feel severe chest pain. The truth, chest pain is a common symptom, but it's not the only one. Especially in women and older adults, symptoms can be very subtle and atypical, such as shortness of breath, extreme fatigue, back pain, jaw pain, or nausea. Myth 3. Once I have heart disease, I shouldn't exercise. The truth. Unless your doctor specifically advises complete rest, physical activity is an essential part of recovery and management for ischemic heart disease. It's important to exercise appropriately for your condition under your doctor's guidance. Myth 4. I can stop taking my heart medication when I feel better. The truth, stopping medication without your doctor's order can be extremely dangerous. Medications for ischemic heart disease are often designed to control risk factors and prevent long-term complications. Myth 5. Drinking a glass of red wine every day will protect my heart. The truth, modern studies have not found strong enough evidence to recommend drinking alcohol for heart health purposes. In fact, drinking too much alcohol can increase blood pressure and harm your heart. Breaking down these misconceptions is crucial for making informed health decisions. Always seek information from reliable sources and discuss any questions with your doctor. We've covered quite a detailed journey together to learn about ischemic heart disease and what older adults need to know. I hope this information has given you a clearer understanding, eased some worries, and equipped you with more knowledge to care for your heart. We've learned that ischemic heart disease is a condition where the coronary arteries narrow, reducing blood flow to the heart muscle. Many risk factors can be controlled through lifestyle and treatment. Warning signs can be atypical, especially in older adults and women, and timely recognition is crucial. Accurate diagnosis is the first step towards an effective treatment plan. Treatment includes lifestyle changes, medication, and interventional procedures when necessary. And most importantly, you can absolutely live an active and meaningful life, even with ischemic heart disease, as long as you actively manage your condition and have support. Your heart is a priceless gift. Treat it with the utmost respect and care. Never hesitate to ask your doctor questions, seek support from loved ones and your community, and always trust in your own ability to take charge of your health. Every small step, every positive change contributes to building a healthier heart and a vibrant golden life. Once again, I want to reiterate, the information in this video is for educational and awareness purposes only. It is not personal medical advice. You should always consult with your doctor or healthcare professional for diagnosis, treatment, and advice tailored to your specific health condition. Thank you for your valuable time spent watching. Wishing you and your family abundant health and peace. We look forward to seeing you in our next content. When this happens, our body reacts by forming a blood clot at the site of the injury, similar to how the body heals a cut on the skin. However, this blood clot is extremely dangerous if it forms in a coronary artery. It can quickly completely block the artery, completely cutting off the blood supply to a part of the heart muscle. This is what causes an acute heart attack, also known as a myocardial infarction. So in summary, ischemic heart disease is a condition where the heart muscle doesn't receive enough oxygen-rich blood because the coronary arteries are narrowed or blocked, usually due to atherosclerosis. It can manifest as stable angina when the blockage isn't too severe, unstable angina when the condition worsens, or a heart attack when a blood clot causes a complete blockage. Understanding this process is the first step to actively preventing, recognizing, and managing the disease effectively. For older adults, the process of atherosclerosis has often been ongoing for decades, and symptoms may appear more clearly, or sometimes manifest very differently than in younger individuals. Risk factors. Who is more likely to get it and why? We've learned that ischemic heart disease occurs when coronary arteries narrow. But what causes these arteries to narrow in the first place? These are the risk factors. Some factors we cannot change, but many others are within our control. Recognizing and managing these factors is key to protecting your heart. Especially for older adults, these factors have often accumulated over many years, making the risk even higher. Age. This is a factor we cannot avoid. The risk of ischemic heart disease increases significantly with age. In men, the risk begins to increase after age 45. In women, the risk often increases significantly after menopause, typically after age 55. The reason is that atherosclerosis is a slow process that accumulates over decades. The older you are, the more time your arteries have had to be damaged and accumulate plaque. However, don't despair. Age doesn't mean you're guaranteed to get the disease, but it means you need to be more proactive in managing other risk factors. Gender men tend to develop ischemic heart disease earlier than women. This is believed to be due to the protective effects of estrogen hormones in women before menopause. After menopause, when estrogen levels drop sharply, the risk of heart disease in women increases and can equal or even exceed that of men. This highlights the importance of women, especially after menopause, paying particular attention to their heart health. Family history. If your father, mother, or siblings developed ischemic heart disease or other cardiovascular diseases, like stroke at a relatively young age, under 55 for men and under 65 for women, you have a higher risk. This indicates that genetics play a role. If you have such a family history, it's extremely important that you are more proactive in controlling modifiable risk factors and regularly checking your heart health. Smoking. This is one of the strongest and most preventable risk factors. Smoking, including secondhand smoke. Inhaling smoke from others causes severe damage to artery walls. It accelerates atherosclerosis, makes blood more likely to clot, reduces oxygen in the blood, and increases blood pressure. Smokers are 2 to 4 times more likely to develop ischemic heart disease than non-smokers. If you are smoking, quitting is one of the best decisions you can make for your heart and overall health, no matter your age. Even if you've smoked for many years, quitting still brings significant benefits, reducing the risk of stroke, heart attack, and death. There are many resources and programs available to help you quit smoking. Please seek help from your doctor or healthcare organizations. High blood pressure. Hypertension. High blood pressure, also known as hypertension, is a silent enemy of the heart. When your blood pressure is consistently high, it puts great strain on the artery walls, damaging and stiffening the blood vessels over time. This makes arteries more prone to atherosclerosis and narrowing. For older adults, blood pressure often tends to increase. Ideal blood pressure is usually below 120/80 mmHg. Hypertension is diagnosed when systolic blood pressure, the top number, is 130 mmHg or higher, or diastolic blood pressure, the bottom number, is 80 mmHg or higher. Controlling blood pressure through a healthy diet, low salt, regular exercise, maintaining a healthy weight, and taking prescribed medication is extremely important. Remember, high blood pressure often has no clear symptoms, so regular blood pressure checks are essential. Abnormal cholesterol levels. Dyslipidemia. Cholesterol is a necessary type of fat for the body, but when there's too much bad cholesterol, LDL cholesterol, or too little good cholesterol, HDL cholesterol, it becomes a problem. LDL cholesterol can deposit on artery walls and contribute to plaque formation. Conversely, HDL cholesterol helps remove excess cholesterol from the arteries. Diets high in saturated fats, trans fats, and cholesterol can increase LDL levels. It's important to regularly check your blood cholesterol levels and make necessary lifestyle changes, including a balanced diet, reducing animal fats, increasing soluble fiber, and potentially taking statins or other medications as prescribed by your doctor to control blood lipid levels. Diabetes, especially type 2 diabetes, significantly increases the risk of ischemic heart disease. High blood sugar over time can damage blood vessel walls, making them more prone to atherosclerosis.